All right. Well, almost good afternoon. I'm Doug Downey. I'm the division administrator normally for the General Support Services Division. I have been the incident commander for this incident, co-incident commander with Jamie lately, but I just wanted to hit on a few things to close out this section of our presentation. And first being, I don't know if you're all familiar or not, but this is the first time with this COVID incident. This is the first time in history of the United States that all 50 states have been under a disaster declaration at the same time. So, pretty big deal, and it's never happened before. And we have the pleasure of being involved in this. So, some of the things that we've kind of gone through and learned and I guess experienced so far is that we have a really great team here at Southwest District Health. The collaboration that's taken place both internally and externally with a bunch of other agencies and organizations that we've never had relationships built with, it's pretty amazing. We have some great people that have taken responsibility for jobs that they were never trained for or never considered to do and never hired for, and they've taken that responsibility and really taken ownership of it and provided the same quality service that they do day to day in their normal work or what they were hired to do. We have a fully trained incident command and response team now at our district. Most of our positions within the command and general staff of our emergency operations center are now 3D. We have people that can back up other people, and they can come in should somebody be out or on vacation or are exposed to COVID, which has happened multiple times since this incident has started. So one of the biggest things that we've found is that our staff really have a lot of heart. You know, most people that work in public health are in public health not because of the money. There's not a lot of money in this this type of work that we do, but they're in it because it's important and it is important to our communities and our citizens and the protection of their health and providing a safe place for our communities and our families. That's what's important to our staff. And the heart that they've shown in taking these new positions and these new roles that they've never been trained for or never thought that they would ever have to fill, it really shows the value and the quality of the people that we've hired and that we have here in our public health district. I can't speak to other health districts, but I can tell you the team that we have here at Southwest District Health and the team that you provide leadership for is top-notch, and you will not get a better result of work from anyone anywhere. I can promise you that. So I just wanted to close with those remarks, and if you have any questions, I'd be happy to answer them, or we have a lot of staff that can help answer a lot of questions. So.
Okay. Questions or comments, commissioners?
Thank you.
Thanks for what you do.
Yeah, absolutely. Thank you.
Okay, now back to you, Nikki.
Thank you. And so the next item here on the list, almost lost my seat.
On wheels.
I have the chairman pick me up off the floor.
No.
Kick
Down. Man down.
Yeah.
Woman down.
A woman down. The next item on here that I want to talk about, and it's been touched on by some of the staff that have just presented, but is just the upcoming impact to the district moving forward. And so I'm kind of shifting the conversation at this point, so that's, I just wanted to give a really broad but detailed overview of where we are with COVID, and then just talk about what we're looking at for the next few months, and really get some input and hopefully some maybe direction from the board on how we move forward in this unprecedented time, and with trying to meet the existing all things we did before COVID, which we have struggled to do, and in most events, when you're responding to an emergency, that's okay for a short period of time. But as this is continuing on, there's other important work that we need to do to keep our community healthy, aside from COVID, and continue to support the work that needs to happen with COVID. But a few of the things that were mentioned that we know are coming up for schools going back in session, and some of that's not going to be in person, it sounds like, and some of it will be. And at some point, I'm sure most of it will be, and I anticipate that will create a different type of work for us. I can't imagine that we will have schools reopen with no confirmed cases of COVID occurring, so that will impact the work that we do in investigations and monitoring. And as well, vaccines, so it's been mentioned about vaccinations. The state has, Department of Health and Welfare has informed the districts that we should be planning for a vaccine as early as mid-October, which still seems really optimistic to me, but they must have some kind of information to support that direction. And so we are getting ready for that. It sounds like that vaccine would be available, obviously not all at one time for broad dissemination, so it would mean that it would likely come to districts to manage, and we would be probably working with partners to get the vaccine into those that are considered to be the priority level, the right priority. As you probably saw with H1N1, when that was rolled out, there were priority groups that had access to that vaccine ahead of other populations. And so I know that until there's enough vaccine availability to distribute to private providers, it will be managed by us, and that will put more work on us. And then, like I said, too, it's going to be busy. Respiratory season's coming, and we'll be looking at flu and pertussis likely, and have other work such as immunizations that are really important this time of year. So with that, I guess the other impact, and Commissioner Dale had emailed about this earlier in the week, was just what the impact will be to our healthcare system as well. So I think, that is something I think to consider as well. I don't see, they'll be busier as well, just because they usually are when flu season starts, with flu and pneumonia, and likely COVID patients on top of that. And long-term care facilities, I know a lot of the long-term care facilities that are having COVID patients right now. One facility I just visited, they have a wing that is empty because they've had so many people have deceased or discharged from the facility, but they're not accepting anybody new. So there's just some interesting things that are happening. I don't know if you can get into a long-term care facility right now. I don't know how many would be accepting new residents when they have COVID cases occurring in their facility.
I don't know if you want to go there. Yeah.
Right.
No.
But yeah, there's still people who obviously may have a need to be somewhere like that, and especially if they're having procedures done and need rehab. That's often the long-term care facilities are used for rehab before they can go back to home to be independent.
Mr. Chair.
Yes.
Yeah, thank you, Nikki, for those comments. I just had the thought as you were talking about this that if you remain in a perpetual state of emergency, pretty soon it ceases to become an emergency, and it becomes standard day-to-day operation. And emergency is supposed to be emergency. And I I just had this thought, I haven't been really thinking about this a lot, and I don't know how to express it well, but at some point, we gotta move on.
Yeah.
Because as you pointed out, we're gonna have a flu season, and people are gonna think they're getting the flu, their first thought's gonna be emergency, I got COVID, I'm gonna die. Well, it's flu kills people too. And so how do we treat that any differently than how we treat COVID? Do we treat the people and make them isolate any differently than we do prior to having this COVID emergency? Those are questions that we may have to address as we move into this fall. And the standard every year predictability of colds and flus and pertussis and all that kind of stuff. So I appreciate that. Look, we got to look forward. This emergency in COVID can't continue to be just an emergency and take up all our time.
Right, yeah, and those are the struggles that,
Resources.
thank
And
you,
resources.
yes, that are somewhat, well, Commissioner Chairman, or Commissioner Elliott and I have had a few conversations about this, that it's, I wish I knew what the right thing to do was, and that's why I really wanted the input of the board here, because I feel like we have a responsibility to the community to meet the needs that are being put on us regarding COVID. But we also have, I feel like, a responsibility to continue to provide the work that we were providing before COVID.
Kelly.
I just got one, I agree with Tom wholeheartedly, but it seems like the state of Idaho and maybe the federal government don't have that same thought pattern, because once we saw a little bit of a uptick in COVID in Canyon County, they reach out and accuse us of not doing the right thing. So, it's all well and good. We're trying to make these right decisions, what we feel is right for our constituents and for the citizens of health of this district. But then we also have riding on our shoulders that the state or the federal government might come in and just tell us what we're going to do anyway. I have a lot of concerns about all of this, because, if for some reason they think that we're not doing what's the right thing and they take over, then what's that look like? I mean, what's that do to district health? I mean, there's a lot of things that are at play here. I was really concerned when I talked to Nikki about what they did with you, because that puts a lot of changes in how we deal with things. I mean, I'm still going to do what I want to do. I think it's the right thing, but I mean, that puts an added layer on top of what we're doing here, because now, if we get another spike in one of the counties, are they going to come back and say, you're not doing your job? I mean,
Yeah, they will.
Yeah.
That's
That's what it sounded like.
well, I mean, but that's worrisome, because if they do that, then they can take it over. I really have concerns about that, because then we'll go back to what it was before. That, I mean, honestly, it wasn't working then either. I mean, yeah, we stopped the curve, but we didn't stop the disease or the virus. I mean, it's still there. So, but we shut down everything. So,
No.
it's a good thing you were on that phone call, because I would have been crawling through the phone.
He might have, right.
It was a little louder than normal.
I just regarding something we said, I don't see any inclination or hints that there may be a shutdown of businesses in the future. I think there's been enough consensus that is too damaging to go down that route. The economy is important to people's health, as well as physical health is important to people's health. And I don't see any desire, either federally or statewide or locally, to say, we're going to shut down business and tell everybody to stay home. I'm glad to say I don't think that's in the book. I hope it's not in the future. And let's hope it stays that.
Me too.
But, yeah. Continue on. I'm glad you're talking about the things that are normal that still need to be done, because they're very important.
And that's where I feel like we need to discuss what the impacts are to the organization, and I need your input on where how we kind of move forward and what the priorities are. And, so I did ask Doug, Troy, Jamie, and Dr. Roster to, provide just a little bit of, overview of how their divisions have been impacted from the business perspective. So not talking about COVID, but I know just from, my perspective, I depend very heavily on them for their expertise in day-to-day management of the organization. We have things that have to be done with budgets and contracts and audits that my concern is there's so much being put on all of them that we're not giving enough attention to the day-to-day things that they need to be also paying attention to. So, but I want them to be able to speak for themselves and not put words in their mouth. So I don't, maybe just have Doug come up, well, I guess come up all both of you if you want, but Doug.